Hello, I'm Frank Long, Editorial Director of Rehab Management. The COVID-19 pandemic continues to hit healthcare hard, including pediatric rehabilitation. The age of this patient population makes treatment challenging at a time when personal protective equipment and social distancing are the norm. For example, face masks can inhibit interpersonal communication and may also frighten some children. Likewise, social distancing policies that restrict the access that parents and caregivers have to healthcare facilities can be problematic. So, how are therapists handling these challenges? We're going to find out right now. Joining us is Todd Danos, Director of Rehabilitation Services at Children's Hospital New Orleans. Todd has been an occupational therapist for nearly 30 years and has been at his post at Children's Hospital since 2016. Todd, welcome to the program.
Thank you, Frank.
Todd, what about those face masks? Tell us, how are they affecting your patient interactions?
Well, the kids have been really great about it. For the most part, they're fairly used to seeing providers in PPE. In certain instances, we did have to stress the importance of explaining the use of PPE and relying on the parents to help reinforce that. Communication-wise, the N95 mask can be a little difficult because it provides such a barrier between voice that comes out. But despite the mask, we're still able to overcome and connect with our patients. It's amazing how much a smile can shine through your eyes and your voice.
What about the supply chain for mobility equipment? What have you noticed about your ability to get seating and positioning, to do trials? How has that affected your work?
Well, on the inpatient side, we've been fairly busy. So we haven't really stopped doing any wheelchair assessments, positioning assessments, seating evaluations. The vendors have been real receptive to come in. On the outpatient side, we postponed our outpatient visits, so our wheelchair clinic and other evaluations of that type were put on hold. But after a couple of weeks, we started contacting our patients and realized that some of this was time sensitive for them. Equipment is breaking. There's time sensitive authorization submissions that need to happen. And so we cranked our wheelchair clinic back up, and we've been very successful with getting some of these patients back in. We don't want to have a negative outcome for a kid because of the situation. And so the parents were extremely grateful we were able to bring our kids back in and do the wheelchair assessments and any positioning needs that they might have. And the vendors, again, were very compliant with that.
What about parents, Todd? Are parents and caregivers allowed into your facility? Have they been allowed to come in during this outbreak? And what have you learned about how to communicate with them in general?
They are allowed in the facility. We have been allowing, we have visitor restrictions like any other facility, but one caregiver per patient can come in. Everyone that's entering the hospital receives a safety screen, a temperature check, and is given a mask. On the outpatient side, we're communicating in advance via individual calls, reminder call system, our website, and through email, so that they're familiar with what to expect when they get to the facility. The patients have been very resilient and have had great attitudes as we navigate through this situation.
Todd, it's possible that there may be a COVID-19 resurgence in the fall. Now, what have you learned over the last several weeks that would be of benefit to you several months from now if there should be a resurgence?
Not knowing what to expect from a pandemic, I will say our hospital, as well as our system, LCMC Health, did an unbelievable job in managing the situation, taking care of our patients and the employees. We developed processes extremely quickly based on guidance from the state and nationally, and that we continue to reinforce and strengthen if there is a resurgence. The most important thing is we want a safe environment in all of our facilities. I feel that we ramped up and used virtual care really well. I think my hospital, Children's Hospital, really set the standard across the city as how to do this. With our administration and physician leadership support, we were up and running, assembled, launched, and grew a platform within days. And that included my outpatient therapy areas. Outpatient therapy for me went from 0 visits to over 300 visits to date. And we're continuing. So I feel we would be in a really great spot if there was a resurgence. Um, we're continuing to plan each day and troubleshoot issues and put some practice measures in place in preparation. So I think we're good.
How would you characterize the response of your staff there at Children's Hospital?
Um, I can't praise them enough. Of course they had questions like any staff would, but our CEO preaches that we need to step in the gap when needed. And, I feel that our hospital, as well as my staff, certainly stepped in the gap to really help out our patients, to really make our parents feel comfortable when they come into our facility. And we had patients to see. So they were very resilient. And even to this day, they're looking forward to just continuing to move on. And, if we do get a resurgence, I'd feel they would react the same way.
We've been speaking with Todd Danos, Director of Rehabilitation Services at Children's Hospital New Orleans. Todd, thank you for joining us.
Thank you, Frank. I appreciate it.